Fatma and I'm a third year medical student at Dow Medical College. My topic is celiac disease. What is celiac disease? So basically, celiac disease is an autoimmune reaction that occurs when a person is exposed to gluten or gliadin. It is actually a hypersensitivity reaction occurs in such patient when they are exposed to gluten or that gliadin component of gluten. On the slide, we are seeing some of the sources of gluten that should be avoided in the patient if they have celiac. It's a rare disease. As you can see, the overall incidence is 0.6 to 1%. Pathogenesis of celiac disease: when you get exposed to the gliadin component of gluten, you get interleukin 15's expression, and that leads to the activation and proliferation of CD8 lymphocytes. That leads to enterocytes expressing MICA to just burst up with an autoimmune reaction. In the genetic makeup in HLA-DQ2 or HLA-DQ8, such incidence occurs more. So that is like predisposing factors. As just discussed on the previous slide, HLA-DQ2 or HLA-DQ8 genetic makeup increases the chance of contracting the celiac, and some environmental factors such as wheat consumption also increases the disease prevalence. Morphology of celiac disease: when you see the histological picture of a patient's intestine suffering from celiac, you'll see T lymphocytes, as you can see here, darkly stained purpled nuclei, T lymphocytes, and some eosinophils. And you'll also see crypt hyperplasia and villus atrophy. So here you can see the atrophic villus is seen. Clinical features and symptoms: they start appearing between the ages of 30 and 60. Sometimes it could be presenting as an atypical or silent presentation. The typical symptoms of celiac include all the symptoms related to the GIT dysfunction, but sometimes a dermatitis, a special type of lesion that is also known as dermatitis herpetiformis. That is a blistering lesion, can also occur in some patient. You can see in the image, this is the image of dermatitis herpetiformis. So the typical symptoms of celiac are shown here. These are all related to the GIT dysfunction, like diarrhea, fatigue, nausea, bloating, gastrointestinal distress, weight loss, stomach pain, and headache, because the intestines are not working. So all are related to the GIT distress. Diseases, diagnosis and management. For diagnosing the celiac disease, you want to measure your IgA antibodies against tissue transglutaminase, that is also called IgA TTG. But if a patient is already deficient of IgA antibody, you may want to resort to IgG antibodies, because if you would check IgA TTG in such patient who are already IgA deficient, it could result in a false negative test. And the management includes, there's no such treatment of celiac, but you can only management. And management involves adherence to a gluten-free diet, leading to symptomatic improvement in restoration of mucosal histology. Complication and prognosis: if celiac disease is not managed properly, it could increase the risk of malignancy, including enteropathy, associated T cell lymphoma, and small intestinal adenocarcinoma. Long term complication could also arise, such as anemia, osteoporosis, infertility, and cancer. Refractory sprue or cancer should also be considered if symptom persists despite a gluten free diet. I've listed some conclusions of celiac disease. You can see them, and that's it. Thank you.